As large parts of eastern Canada experience the first major heat wave of the season, there are key things everyone can do to protect themselves during hot temperatures. However, heat doesn't affect people equally. People most at risk are the elderly, infants, pregnant women, and people with disabilities or mobility issues. Heat waves are the leading cause of weather-related deaths in Canada and the United States, killing more people than hurricanes and tornadoes combined. Three of the most common conditions to watch out for are dehydration, heat stroke, and heat exhaustion, but most heat-related deaths and health problems can be avoided. I'm now joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you for joining us today.
Good evening.
Now, what makes heat waves so dangerous?
Well, in Canada, heat waves, as you mentioned, really caused more deaths than any other natural disaster. StatsCan really counts roughly 500 to 700 excess deaths that we have per year based on heat-related issues. Now, why is that? It's because, well, heat stress and dehydration. So high temperatures cause the body to lose water through sweating, and that prolonged exposure to heat can lead to dehydration. That prolonged dehydration can start giving you symptoms of heat exhaustion and even heat stroke. So heat exhaustion is with heavy sweating, weakness, and dizziness, and heat stroke is much more severe and can be life-threatening and causes confusion, rapid heartbeat, and even unconsciousness. So what we see is this aggravation of existing health conditions can certainly worsen people experiencing these morbidities here. And we also do see now an urban heat island effect, which means urban areas tend to be hotter than rural areas because of buildings, roads, and concrete absorbing and retaining heat. And that's why we see a lot more deaths these days, unfortunately, in major cities such as Toronto and Montreal.
As you mentioned, heat waves can be fatal, but are there long-term effects that weather-induced heat exposure can do to the human body?
Yes, what we have seen is prolonged exposure to extreme heat can have quite a few effects. The first one would be cardiovascular health. So a chronic heat exposure can strain the cardiovascular system. It can lead to increased heart rate, blood pressure, and overall stress on the heart. We also see kidney function being impaired. So kidney function, because of the dehydration and the excess sweating, can cause a strain on the kidneys, and then it affects their ability to filter waste products. We also see increase in kidney stones and other kidney issues as well. We see cognitive function issues. So heat waves can impair cognitive abilities, and we certainly see that with studies on memory, attention, and decision making. And respiratory is a big part of it as well. So heat doesn't directly affect the respiratory system, but what it does do is worsen the air quality. So during heat waves, the ground level ozone and particulate matter really affect health. And I don't think anyone slept well in Toronto yesterday because of the heat wave, but sleep disruption is a major issue that we see as well. So nighttime temperatures disrupt sleep patterns, and poor sleep, of course, has a lot of health implications, including mood disturbances and weakened immune systems.
Now, how do heat waves like the one we're experiencing right now impact children versus adults?
We have some physiological differences, of course. So children have a higher body to area to body mass ratio, which means they absorb heat more quickly, and they don't have very good thermoregulatory systems. So it's harder for them to dissipate that heat efficiently. Children also may not recognize when they're overheating, or they do express discomfort effectively, and so they might continue playing or staying in the sun. From a vulnerability perspective, of course, infants and toddlers are especially vulnerable. Their bodies heat up rapidly, and they do rely on caregivers to keep them cool. But for adults, we see seniors as well, and those who are disabled also at risk for these heat-related issues.
And what are some of the best ways to cool down during a heat wave?
Sometimes it feels like there is no great way to cool down, but the most important thing here is to stay hydrated, drink plenty of water during the day, try to seek shade as much as possible. So find shelter if you're outside amongst trees, umbrellas, or any covered areas. If you're indoors, use fans and air conditioning to help circulate the air, and wear very lightweight clothing. I think that's very helpful. Now, if none of those work, then there are some other options as well. Cold compresses, for instance, wet towels or bandanas, taking cool showers, and avoiding alcohol and caffeine.
Now, you mentioned heat stroke. What are signs that you or someone you know may be experiencing heat stroke, and what can be done to treat it?
So heat stroke can be very serious and severe. So what we want to do is make sure we know the signs very well. The top four ones really are high fever, so a body temperature above 104. We also see mental changes, so confusion and agitation. We see dry skin as well, so hot and dry skin or even heavy sweating. And other symptoms like nausea, vomiting, and headaches. So if you suspect anyone has those symptoms, move them immediately to a cooler place. Use cool water to cool the body as soon as possible. Hydrate them, so offer them chilled water, and call for help because it's a serious condition that needs to be addressed right away.
Dr. Raut, thank you so much.
Thanks so much for having me.